my name's Jackie. I'm a registered nurse in the St. David's Hospital AFib Center. Our AFib Center is set up for patients that come to St. David's Hospital to have AFib ablations with our doctors. And I'm going to talk to you about what AFib is and the treatments available. Atrial fibrillation is a heart arrhythmia that comes from the left upper chamber of the heart. It's called the left atrium. And it's an arrhythmia that occurs sometimes later in life, or sometimes it's caused by heart disease or diabetes or high blood pressure, something like that. Some patients have symptoms from the arrhythmia. Sometimes they have palpitations or fatigue. They may feel short of breath when they exercise, that sort of thing. Sometimes people don't have any symptoms at all, and they're just diagnosed when they come into the doctor's office. Usually when you see the heart doctor, they will run an EKG, which is a tracing of your heart rhythm, and that's how they can tell that you have atrial fibrillation. Once they decide that you have atrial fibrillation, they do some testing on your heart to decide how the atrial fibrillation developed. Sometimes, as I said, people have coronary artery disease, and that could cause the heart to have some arrhythmia. So they'll do some testing on your heart that can include stress testing, where you walk on a treadmill. They may do a test called an echocardiogram, which is to test the function of the heart, how the heart squeezes, and the size of the chambers of the heart. Sometimes they'll do further heart monitoring, where you'll wear a heart monitor for a period of time, sometimes 24 hours, 48 hours, so they can tell if your heart is out of rhythm all the time. And then once they determine that you have atrial fibrillation, they've ruled out any heart disease, then they'll offer you different types of treatment. And there's several types of treatment. The first is medications, and there's two types of medications that they use. Well, actually three types. One is to control the heart rate, and one's control the heart rhythm. The third is because when your heart is out of rhythm, you have a higher chance for forming a blood clot in the left atrium. They may offer you what they call an oral anticoagulant medication. The most common one is Coumadin or warfarin. Most people have heard of that, but we now have several other types of oral anticoagulants called Xarelto, Pradaxa, and Eliquis. If the patient is continuing to have heart arrhythmias, even on medications, then they may elect for you to go for what they call a cardioversion. And that's where you come into the hospital, they put you to sleep for a few minutes, and they actually shock the heart back into rhythm. And then the doctor will wait a period of time to see if your heart will maintain rhythm on just medications or without medications. The last form of treatment I'm going to talk about for atrial fibrillation is called an AFib ablation, and that's what we concentrate on here in the AFib Center. This is a special treatment where a patient comes into the hospital. They go to a specific part of the hospital called the electrophysiology lab. The doctor has you put to sleep, and while you're sleeping, they are able to go into the left upper chamber of your heart and find all the triggers that are putting your heart out of rhythm. These come from the back wall of the heart, the posterior wall, and these four pulmonary veins that bring the blood back from the lungs. What they do is they take their ablation catheters, they find the areas that are putting your heart out of rhythm, and they ablate them, or they burn those trigger points, so that once the heart is healed, there's a small scar tissue that's formed that will prevent the heart from going out of rhythm.
Hi, I'm Cindy Williams, one of the nurse educators for the AFib Center here at St. David's. Today we're going to be talking about things leading up to your ablation. We want you to feel very comfortable coming to Austin and St. David's for your AFib ablation. So we're going to go over certain things that will happen as your date approaches. A consultation with one of the electrophysiologists is usually the way that talking about an ablation begins. That consultation can happen either here on the St. David's campus or at one of the EP clinics across the state. That's where many doctors first come across AFib patients for us. So in planning for your ablation, you'll have a consultation, as I just said. During that time, the physician will describe the ablation and then ask us as AFib nurses to send you more information. That information will also include things about making your visit to Austin and coming here more comfortable for you. We don't want you to have to worry about the details of arriving in Austin, perhaps in a strange city that you might not have been to for quite a while. So you will receive information about hotels, how to get yourself here, where the hospital is, restaurants nearby, where to park, what door to enter. We know these are things that can cause anxiety, and we want you to concentrate on feeling comfortable about your ablation and not which door you're going to enter into at the hospital. So you'll receive information, things like that, from us. You'll have all our contact info, so you can contact us via email, phone calls. You can fax us records as needed. So once we get you here to Austin, you've got your map in hand. You know you've parked your car. You will present yourself to the admitting desk at St. David's. That's where your admission process begins. They're going to need to see your identification, your verification of insurance, other valuables you can feel fine leaving at home. Bring a list of your medicines. That's very helpful to the admitting nurses here at St. David's. So once you arrive at the hospital, that process will start. Some of the physicians will want you here a day before the procedure in order to get a CAT scan of your heart. That's information that will be formatted into the software program that the physicians use during the ablation. It gives us data about your specific anatomy of your left atrium where the ablation is going to be taking place. So if you have a CAT scan scheduled, you'll be notified that by the schedulers. They're the ones in the TCAI office that talk to you about the date and time of your ablation, when that will be set up. So once all that's accomplished and you're here in Austin, you'll know whether you're going to have a CAT scan, whether you're here the day before or the morning of the ablation. Blood work's going to be done at that time. Consents will be signed. All that will be explained to you by the admitting staff. Other than that, you will spend the night before the ablation in a nearby hotel or with family or friends if you're lucky enough to have someone in Austin that you can stay the night with. Times of arrival will be confirmed by the hospital staff. Sometimes those can change based on a physician's schedule. So you just listen to the latest and greatest information that you get from the admissions office and the pre-procedure admitting nurse on that. Now that we've gone over some of this information, we hope that you're confident and that you'll feel very comfortable in your arrival here at St. David's for your ablation.
Hi, I'm Becky. I'm one of the registered nurses here at St. David's Medical Center and the AFib Center. I am going to discuss the day of your procedure, what exactly we want you to do, where to go, and what's going to actually take place. Please come to St. David's Medical Center, walk through the large rotating door at the front of St. David's that is located by valet parking. Once you walk through that door, to your right-hand side you will see a young lady sitting at a desk. Same place where you checked in the day before if you had a CAT scan done or any pre-admission testing done. She's going to direct you down the hallway to cardiovascular services. As you walk down the long hallway to your right, you're going to see the atrium. Once you pass the atrium, to the right-hand side is cardiovascular services. That is where your pre-admission is going to take place. That is the same place you were the day before when you had any blood work drawn or even possibly had a CAT scan done. Once you walk in, you're going to be greeted by some registered nurses who are going to take exceptional care of you here at St. David's. Not only are they going to take exceptional care of you, but also your family. We're going to get you ready for the procedure. By first of all, you're going to meet with anesthesia services. Anesthesia is going to go over exactly how everything is going to take place and getting you asleep for the procedure. Everything is done under general anesthesia, so you will be completely asleep. All we ask is that you make sure that you've had nothing to eat or drink after midnight, and also that you have followed your medication instructions to the last detail given to you by your AFib nurse educator. If you should have any questions about those medication instructions on the day of the procedure, please contact your nurse educator. It's very important that you follow those to the last detail. Anesthesia is going to review exactly what they are going to do to help make you comfortable for the procedure and even after the procedure. If you've had anesthesia in the past, maybe you've had some nausea, maybe you've had some vomiting post-procedure, please discuss that with the anesthesiologist. It's very important. They will formulate a cocktail just to suit you perfectly so you wake up smoothly with no nausea and vomiting post-procedure. Should you have any other issues post-procedure, such as maybe some back discomfort, also discuss that with the anesthesiologist. They will once again make sure that you have proper sedation to keep you comfortable post-procedure. After anesthesia meets with you, the registered nurses down in the day recovery or cardiovascular services are going to get an IV started. Some of our patients will receive a TEE, which is a transesophageal echocardiogram. That is where we give you some sedation through your IV, make you very groggy, very sleepy. Once you are asleep, we pass a small tube down your esophagus just to take a peek at your heart. We want to make sure that there is no clot in your heart before we begin the procedure. That is done by a cardiologist. You will also meet the cardiologist prior to the TEE, the transesophageal echocardiogram. Now, don't worry, if you do not have a TEE ordered, then that is not part of your specific physician's protocol. It is the nurse educator's job to make sure that if you need a TEE, one of them is on the schedule for you that day. If you have any further questions about the TEE, please contact your nurse educator. She will clarify any question that you may have. Now, when it comes time for the procedure, when the electrophysiology staff, the staff that's actually going to assist the physician with your procedure, they're going to meet you down in the day recovery area or cardiovascular services. You're going to meet the nurses and the technicians that will be assisting your physician. They will talk with you and with your family. If you have any further questions in regards to what exactly is going to take place during the procedure, please discuss that with the staff that's going to be with your physician. When it comes time for your procedure, the electrophysiology staff that's going to be assisting your physician will escort you up to the second floor. You will be on a stretcher, your family will be walking next to you. When it comes time to go through the big double doors on the second floor for your procedure, you will give a big hug and kiss to your family and tell them that you're going to see them shortly. At that time, you're going to be escorted into the electrophysiology lab for your procedure. Your family is going to be comfortably waiting for you in the cardiology waiting area on the second floor. There should be a volunteer also there to assist your family should they have any questions in the cardiology waiting area. The EP staff working with your physician will keep your family up to date on what exactly is going on while you are in your procedure. Your procedure should last anywhere from 2 to 4 hours in duration, and your family will be kept updated throughout the whole time. At the conclusion of your procedure, you're going to go to the recovery room just to let some of that sedation wear off. We want you to be nice and awake by the time you meet your family post-procedure. Once you're in the recovery room, your physician is going to go out and update your family on exactly how wonderfully everything went, what they were able to take care of, and what to expect next. Post-procedure, you're going to go to your own private room here at St. David's on the second floor, and that is where you're going to be reunited with your family. You're more than welcome to have a guest or a family member spend the night with you. There is a sofa or a recliner in every room to keep your loved one comfortable while you're here at St. David's Medical Center. Once you reach your room, you will be on bed rest for about 5 to 6 hours post-procedure. Your head of the bed will be allowed to be raised up to 30 degrees. Now, if you have back problems or any discomfort, please let your nurse know. They are here to provide you with exceptional care, and they will make sure that they can reposition you to keep you comfortable or administer any medication that you may need to keep you comfortable post-procedure. We would like you to lay flat with your legs relatively straight. Do not bend, twist, or turn. What we would like is we want to make sure that you do not ooze or bleed from those groin sites. That is the access point for the procedure that the doctor utilized. If you should cough or sneeze, please apply pressure to those sites. Once your bed rest has been completed, you will be allowed to get up and to walk around where you feel comfortable. You may walk the hallways accompanied by your family member or friend that stayed the night with you, or one of the staff members will be more than happy to escort you up and down the hallway. Once again, we want to make sure that you do not bleed or ooze or have any problems in the groin sites post-procedure. You will be given a menu so you can order your dinner for that evening as well. Now, you will be monitored with a heart monitor throughout your stay on the second floor. Once it is time for discharge, that monitor will be removed. Please make sure that that monitor stays in place so we can continue to monitor your heart throughout your stay here at St. David's. Should you have any questions, should you have any concerns, please feel free, pick up the phone, call your nurse educator. We are here for you. We are here to provide you with exceptional care and exceptional service.
Hello, I'm Shirley. I'm the AFib nurse educator for you, and I will be giving you your post-operative instructions. Some of the post-operative things you may see, and most common, you may see some chest discomfort. You may have some fatigue. You may have some mild shortness of breath on activity. You may also have some soreness in your groin sites and your bruising. You may have some down the leg as well. Another thing that you may feel up to 3 months post-operative, you may have some rhythm and rate changes of your heart. That is not abnormal. You will be monitored post-operatively with an outpatient monitor system. Other areas that we would like you to call us on, we use sometimes retain fluid post-operatively. It's called fluid retention. That it's not uncommon because they use extra fluid when they're ablating inside your heart. And we want you to be able to know the symptoms of fluid overload. You would have some swelling of the hands, ankles, your abdominal girth. You may have shortness of breath lying flat or just rest. You may have a weight gain of over 2 pounds overnight. We would all like to know about that if you had those symptoms. Another area, if you were to have any bleeding or swelling at the groin site, we would like to know about that. Also on your activities, you will be asked to have someone drive you home. You should not drive for 2 days post-operatively. You may shower the day of discharge and remove your dressings, but we ask that you not go use a bathtub or a hot tub and just keep the area dry. Also, you will no heavy lifting, push-pulling for 7 to 10 days, and you may resume your normal activities after about 10 days. Another thing is that you will have a post-op visit 6 to 8 weeks after post-op. And I want to thank you very much for your time. If you have any of these symptoms that you need to call me about, please notify you. Otherwise, I will be contacting you shortly.
My name's Curry Teckenbrock, and I'm a nurse educator for the AFib Center here at St. David's Hospital. I want to talk with you guys today about the monitors that you will be using after the ablation procedure. We use 2 different types of monitors. One's a long-term and one's a short-term monitor. The monitor itself is a simple handheld monitor that you would use once a week for about 5 months. The whole information about the handheld monitor is that it's for short term, so it takes about a minute snapshot, and so that we can see what you're doing at that moment. It's also an event monitor so that we know that if you go out of rhythm and you're having an event, we can also capture that at that time. The long-term monitors are the 7-day Holters, and our new monitor, which is the small reveal link. The link works as the short-term as well as the long-term monitor. It's right at the level of the rib cage in the mid-sternum area. It requires to be placed at the time of the procedure, and you have 1 stitch, and the care afterwards is just normal care of any surgical procedure. What the link does is that it will act as a short-term as well as a long-term, so that you won't have to have 2 separate monitors. It works on a cell phone service, so that the transmissions are sent over the cell phone service rather than over landline, which the handheld one will do. And we monitor you weekly for the first 5 months, and then after that we will monitor you every 6 months for the first full year after the procedure. And that is what we do with the post-op monitoring system. If you have any questions, please notify your nurse educator, and have a great day.